Well, welcome to Daniyal Ultrasound. This is middle-aged person complaining of abdominal fullness, not knowing what is happening with him. Now on ultrasound we see here, this is the beginning, right, this is right liver lobe, craniocaudal view. This is inferior angle, this is the superior part of the right liver lobe. What we have to see here is the size of the liver first. This is liver. It measures approximately 15.5 centimeters. Another thing is the angle, which is quite sharp. Third thing is the contour of the liver, which is irregular here, you see. This is irregular contour of the liver. And the fourth one is brightness. The liver is slightly, echopatron is slightly increased if we compare it with the kidney. So right liver lobe is surrounded by the hypoechoic fluid. This is the massive fluid which extends from the liver and upper part of the abdomen to the lower part of the liver. You see here, this is urinary bladder, this is the wall of the urinary bladder, this is cirrhotic fluid. We said ascitic fluid, ascitic fluid. It is now the fluid contains no echoes, no membranes, no debris, I mean say. So this is a clear-cut ascitic fluid due to portal hypertension, and this is the case of cirrhosis liver. Another thing we have to measure here is portal vein at the end of the inspiration and at the end of inspiration. This is portal vein which measures 1.4 centimeters at the end of the inspiration, and at the end of the expiration it measures approximately 1.3 centimeters. Still another important thing I would like to show you here is the periportal fibrosis. Periportal fibrosis, here is the wall of the portal vein. This is portal vein. This is portal vein. The wall is quite thicker and showing enhanced echopatron. This is called periportal fibrosis, which is also visualized in the liver as well by its increased echopatron. So this is liver, and gallbladder is additionally thick-walled. You see here, this is gallbladder. It shows thick-walled. It's not due to the cholecystitis, but usually due to the reaction, and because there is massive free fluid around it, as well as there's edema, liver infection. So due to these reasons, the gallbladder wall is thickened. So do not be confused with a thick-walled gallbladder in cases of cirrhosis liver or when there is fluid. This is right kidney. It appears normal in size and shape. Cortex is normal. Now let's go to the spleen. The spleen is again enlarged, you see here, and there is also fluid around the spleen. The spleen measures approximately, let me take the size. The spleen measures approximately, here is the spleen size. It is 14 centimeters in length. This is left kidney. Now let's go to the splenic vein, which appears also engorged. This is splenic vein. Taklifa Baba? Siddharth, you know, splenic vein is also engorged. Patient is having discomfort, so I'm not taking that much time on it. So here is the left lobe of the liver, you see. Another thing I missed here is that I would like to show you the parenchyma. Parenchyma is coarse in this case. It is not homogeneous, but it is coarse parenchyma. So here is the Again, you see this is free fluid, and these are guts moving freely in the free fluid. This is the gallbladder, urinary bladder. This is prostate. Overall, this case indicates cirrhotic liver changes with the portal hypertension, development of the portal hypertension. Let's pray for him. Thank you very much.